Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our Health Talk today is senior citizen health safety. I have done this several slides presentation before on different health issues linked to the senior citizens. But today, mostly, I'm going to concentrate on some of the major issues that we face during this frigid winter. So, starting from the first slide, a good, healthy living is a blessing from God. However, we have to put in our efforts to live a long, healthy, and happy life in body, mind, and spirit as we are aging. So these are a few I have presented it in my first slide. The few tips: healthy diet, stay socially active, exercise, including meditation, yoga, a routine health checkup, and immunizations up to date is very, very important for all of us in all different ages of life. And lastly, thinking positive, that has a strong effect upon our healthy life. Next slide, please. So, what are the general safety tips? I have summarized a few of them. Number one, preventing fall in elderly. It is important to remember that falls are number one cause of death in our population, elderly population, because it mostly impacts the whole body, leading to hip fracture, multi-organ injuries, brain injuries, and more. So what are the major causes of fall? Most important thing is loss of balance due to poor muscle control, a dizziness spells if somebody is on the medication, irregular heart rate, or just a simple slip and trip. We have noticed that the post-pandemic area, there has been a very increase in the poor health, which is due to lack of mobility, missing doctor's visits, depressions, loneliness, and high substance abuse. Next slide, please. So what do we do? Avoid slipping on the ice to prevent a major fall. Dress light, loose, and layered. Fight the winter-related depressions, and I'm going to talk to you later on about some of the ideas, some of the regime to follow to fight the winter-related depressions. Keep your home well heated, get it checked for gas line. Most important also is the carbon monoxide poisoning. A frequent checkup by the physicians is very, very important. And stay updated with your vaccinations. And I cannot say more and more about this because during the winter months, there is an epidemic of flu, pneumococcus vaccines, and all those. So always better to keep you up to date with the vaccines. Eat a well-balanced meals and avoid junky food. Exercise, yoga, and meditations are also, they play a significant role in the body. Next slide, please. Okay. Also, always listen to the weather forecast and be prepared for the winter storm. Have emergency kits handy in the car, at home. Wear life safety bracelets for emergency contact if you are home alone. So what are the major cold-related illnesses of concern during this frigid winter-related depressions, very, very common, hypothermia and other body temperature-related ailments that are caused by the cold. So, what are holidays blues and seasonal affective disorder? See, we pass through the holidays like Christmas, Thanksgiving, Christmas, Valentine Day, but still, there are so many after effects that it lingers to your body and the mind. The holiday seasons usually is a time for joy and celebration. A recent poll by American Psychiatric Association says that the seniors are 5 times more likely to experience sadness, anxiety due to the loss of the jobs, loss of the loved ones, or missing their relatives. Furthermore, a recent CNS news report, and I have included those in my bibliography at the end of my talk, shows that the elderly are drinking more alcohol or overdosing themselves with the fentanyl-laced street drugs due to depression. So what happens if the persistence of these same symptoms during winter month can also lead to a condition called seasonal affective disorder? Persistence of extended holiday blue is called seasonal affective disorder, which is defined as a period of sadness, loneliness, depression, anxiety during fall and winter month. However, most of them, they subside during spring and summer, but some of the symptoms, they persist. The persistent symptoms are anxiety, restlessness due to lack of sleep, reduced social interaction, and inability to work. The good news at these feelings are temporary, and they get better as the spring arrives. So what is the treatment regime for this winter-related seasonal affective disorder? A very thorough evaluation includes a good physical examination by your physician, asking in depth about the questions, and a mental health questionnaires by your physician, followed by a blood work and metabolic profiles to rule out any severe major illnesses like thyroid disease, obesity, diabetes, and more. A psychological evaluation by a mental health personnel is also very important. Next slide, please. So, what are the treatments for the seasonal affective disorder? General good health care that includes nutritious diet, exercise, yoga, proper clothing, and safety measures against fall. The treatment also includes the light therapy, psychotherapy, and the medications. Light therapy, what does it do? It helps with the overcoming depressions during winter blues, and they are described in details, and I have included that in the bibliography. Light therapy is one of the first line of treatment when you sit a few feet away from the light box during the morning hours. And what it does, it causes a change in your brain chemicals and improves the mood. Psychotherapy, also known as cognitive behavioral therapy, helps in identify your negative thoughts and how do you manage the stress. There are several medications. If the above two doesn't work, there are some medications that include antidepressant for severe symptoms of depression, and mostly an extended release antidepressant. The most common one in the market right now is the Wellbutrin. But these are prescribed by the psychiatrists and the psychologist. So what now after this light therapy I'm touching the topic of hypothermia. Hypothermia is caused by a prolonged exposure to a very cold temperature that causes the body to lose heat faster. The examples such as the hikers who riding the mountain or the motorcycles riders or the elderly also who have poor circulation in the body, inadequate heat at home, and the homeless people. The symptoms of the hypothermia include shivering, mental confusion, memory loss, slurred speech, and drowsiness. The immediate treatment for this includes getting the person out to a warm area as soon as possible. If they are wet, remove the wet clothing because the wet clothing can further add to their low body temperature. It's very important to warm the core area of the body, such as starting from the neck, head, chest, groin, and covers the whole body with a warm sheet. So here is two examples of the cold-related injuries in this diagram. This is a normal foot and ankle. What happens when they get a frostbite? Frostbite is injury to the body due to prolonged exposure to chilly weather, and then there is a trench foot, which is a very more prolonged exposure to the body that cuts down the nerve supply and causes a big swelling along the foot and the ankle. So hypothermia, what is it? It is a decrease in the core temperature to a level at which normal muscles and the cerebral activities are impaired. The fall in cold temperature is due to the decreased cerebral body metabolism. Clinical features of hypothermia include shivering, pallor due to poor circulation, mental confusion, a sluggish body response, slurred speech, irrational behavior. In severe hypothermia, the core temperature falls below 92 degrees. This is a life-threatening condition, and this can include a violent shivers, falling, pale skin, muscle rigidity, bradycardia, as well as dilated pupils. So frostnip, this is the mildest form of hypothermia, which is freezing of superficial layer of skin, such as around the earlobes, the cheek area, fingertips, toes. And this is managed by just a gentle warming, by blowing warm air against the warm body, but avoid rubbing the affected area. Substance abuse and alcohol addiction among senior citizens. This has been a very big topic here, a recent burning topics of these days. And there has been a recent rise in alcohol drinking as well as the painkillers, as it has been reported by the CNN and the CDC. The clinical features include fall, loss of balance, use of multiple prescription drugs. Drinking too much alcohol can worsen the existing health conditions such as osteoporosis, liver damage, high blood pressure, diabetes, immune system disorder, and memory loss. Furthermore, when combined with the drugs, the alcohol facilitates further more damage, and it leads to the potentially life-threatening conditions, which our senior citizens are already compromised. So, in summary, the winter related illnesses can include starting from the common cold, flu, pneumonia, or bronchitis. Unfortunately, many of these illnesses can merge during the winter month and also due to different strains of COVID 19. So we have to take extra precaution. The COVID-19 has a major significant effect on our illness. There has been different strains emerging all throughout, starting from Omicron, that Omicron B, and so our body gets exposed to all the different strains of the virus. So it is very important for all of us to get the proper vaccines according to the age. And remember, like April showers bring May flowers, and have a safe and a happy winter and spring ahead. These are the bibliographies, most of them have been mentioned in my previous video tapes, and if anything is missing, we can. I request our viewers to go through my previous videos, which are all with the Vimeos.com and the YouTube. Lastly, I thank our viewers for watching me today. The topic was senior citizen health safety. I'd like to thank our producers, our camera crews for helping me produce this wonderful tape. Thank you again.